Hello everyone, my name is Brijnandan Tripathi and I'm really grateful for you all for joining this session. And today is 10th September and that day is celebrated as World Suicide Prevention Day all over the world. And this video particularly is in collaboration with Innomind, Psycheneers and Shreeedushala and Maverick Times. So today we have a special guest with us, Aditi, and she'll be taking us over the session after a few slides. The reason for getting into this seminar was because I have seen one of my friend, actually a college senior who from IIT ISM Dhanbad, who committed suicide. And this is a problem that we see or hear, means with friends or their friends, and we do not feel like it's something that is to be taken care of until unless we feel we get affected personally by it, right? So we do not get offended or we do not feel the pain exactly the people they have suffered. And in this current scenario or this post COVID era, most of the people have suffered a lot in their mental or physical health. I will not be talking about the physical health, but yes, I'll be talking about the mental health and all those things. And the speaker itself will tell why I have striked or why she have striked the health from here, and she has written hygiene. At first, I wrote health, and she has corrected it with hygiene. She will actually explain why this thing is being done. And this whole session is basically you can find it on Innomind YouTube app. And let's move ahead with the data why this session is being done. So I'll show you a data that is by ADSI report 2021. So you see there are two circles here to the left. Here I have state wise percentage, like how many people have committed suicide in the past year, that is 2021 2021. And you can see Maharashtra, Tamil Nadu and Madhya Pradesh have been on the top of the list for the consecutive 3 years. And then moving to the second circle, this circle is basically telling how many percentage of how much percentage of exactly the students who have committed suicide. You see, the numbers are really high. 8% of the total death that have been recorded are of students, right? And in that also the maximum is for matriculate or the secondary level, that is class 12. Then we have mid level. Aditi, can you please approve that request? Then we have mid level, and then secondary, higher secondary level, and then we have primary level. At the bottom section, you can see the number of male and female people who have committed suicide. And you see the number of people between the age group of 80 to 30 is quite higher in case of male, and it's lesser in female. But when you see below 18, that number is means I don't know how, but surprisingly it's high for females. For the below 18 years, it is very high for female, and in case of 18 and 30, it's high for male. So all these topics, like how to manage your mental health, how to handle all these problems, is a very important thing, and we must be prepared to handle such situation. It can happen to any of us or any of our friends, right? So before we move ahead, I'll just request you to please turn off your camera or mobile phone. Although the request is denied from my end, you cannot turn on your camera or mic. We'll open that at the end during the questionnaire session. And meanwhile, if you have any doubt, you can keep typing that all questions in the chat box itself. And I'll just give a few hints or exactly a few brief outlines what exactly we are going to cover. So we'll be covering about the mental health and how it is more than just the mind, and why is it so crucial that we are covering this in a lesson, and even the world is celebrating this day as anti-suicide prevention day, like suicide prevention day. And how to maintain your positive health, And if in case you are suffering from any trauma or any mental health issues, how to diagnose all those things, and if you have diagnosed, how to reach to professionals for any kind of help. And I'll hand over this to Aditi, and she will be exact telling you and taking over the session from here on. With Aditi, stage is all yours, please.
Thank you. Um, and good evening, everyone. So, as Bridge mentioned, that today is World Suicide Prevention Day. So, a very sensitive topic to discuss on, and a sensitive but ignored topic to discuss on. So, let's go ahead. I'm a well-being professional and a psychologist. So, let's go ahead and see what are the preventive measures we can take to help our own self and the people around us. So so every suicide occurrence is basically a public health issue. It's not just an individual issue, it's a public health issue that has significant effect on the people in the area. One suicide is not just limited to an individual or his or her family. It also has a significant effect on the people in the area. We can lower the number of suicides worldwide by increasing the knowledge, removing the stigmas associated with it, and promoting the informed action. So, as we say, it's a public health issue. So, now we need to more focus on how to do it. So, when we say mental health, we just talk about the state of mental health. Today, when we talk about mental health, we connect it very easily with the words like stress, depression, rather than saying I have a very good mental health, I'm good, I'm fine. We connect it as I have some mental health issues. We often use the word mental health with some kind of issues associated with it, rather than using it with some positive words like I'm feeling good, I'm happy, I have a stable mental health. Coming on the theme, this the theme for the year has been creating hope through action, and it's not just a theme for 2022. It's a 3-year theme, from 21 to 2023. It is creating hope through action. That's why we are just not going to talk about mental health, but also mental hygiene. That means the actionables. We're not just going to discuss about the state of mind, but more of the actionables that we can do. How can we focus more on the mental hygiene? So, this theme attempts to instill hope, brightness in all of us, like by serving as a reminder that there are alternatives to suicide. The theme itself explains that there are alternatives to suicide, and we need to keep that in mind. So, creating hope through action. Through our actions, we may show those contemplating suicides that there is no hope, that we care about them and want to help them. It also implies that our efforts, no matter how great or tiny, might give those who are having a hard time. So, let's start with understanding what is mental health. So, when we say mental health, it's a very positive concept which encompasses of the emotions, our psyche, our social interactions. It's not just very much limited to the state of mind, but our overall mental well-being. It's a holistic well-being that encompasses more than the present state of mind, because your actions are more usually oriented to what are the things that you have learned in the past, and what can be the future outcomes. Your present actions are always enabled on your past experiences and the future outcomes. That's why mental health, when we say mental health, it's not just the present state of mind, but it's more than that. So it's more than a state of mind. Coming on to what are our thoughts on suicide. Now, suicide is something that we have been hearing it, but not focusing or prioritizing it too much. When we someone says I'm not feeling well, we say okay, come on, overcome it, forget about it. These are some statements that we use, making that person feel that we are not able to understand what he or she is going through. But then we need to understand the sensitivity of it. Globally, every 4 seconds an individual commits suicide, which is a very alarming rate. Now, mental health is integral. When we are mentally healthy, we can realize our abilities, cope with stress, work productively, and contribute to the society. But what happens when we are in a disrupted state? See, we need to understand what is life. If we break life into two, LIFE, look internally, forward externally. Look internally, forward externally. हम materialistic world में we are doing all the work that we are supposed to do. Study, work, earn, teach, anything that we are supposed to do, we are doing it daily. That means we are forwarding externally. But what about looking internally? Are we doing that? Is our life complete today? We need to think on that, because life is all about looking internally and then forwarding it externally. So until unless you know yourself better, you introspect yourself, it's very hard to move ahead. So every day we are externally forwarding things to the materialistic world in the form of work, action, and other things that we're doing. But what are we doing for our inner self? Here comes the importance of introspection. We need to introspect within that, what are the thoughts that are going across in throughout my mind throughout the day. What are it? Am I going too negative, or am I perceiving the world in a different way rather than other people? We need to check on it, and what are the reasons behind it. I'm not saying sometimes we have a tendency to get negative over such sudden things, but we need to understand that why am I going so negative. इतना नेगेटिव फ्लो क्यों हो रहा है? क्या मेरा कोई पास्ट एक्सपीरियंस है जो उसको गवर्न कर रहा है? क्या कोई डर है फ्यूचर का? कोई फियर है जो गवर्न कर रहा है? वी नीड टू चेक ऑन दिस एंड रैशनलाइज इट. अगर हम बिना किसी बेसिस के डरेंगे, इट इज कॉल्ड इरेशनल फियर, which can come up with which can come up in different forms. As today people are facing with so much of phobias, depression, sudden panic attacks. They don't know when they will get a sudden panic attack. They can be anywhere in their life, like they might be going through a mall, sitting in a metro, and suddenly that person goes through a panic attack because they're unaware कि internally क्या चल रहा है. So here comes the importance of introspection. Write it down. If certain things are disturbing you, write it down. What are the things are disturbing you and why it is? Once you get the answer of the why, that thing will not disturb you, even if you have a very negative basis of that, but at least you have a justified reason. When things are mingled up, they disturb you not just mentally but also physically. These days psychogenic problems have been very common. We see people complaining that all the lab tests, diagnosis, and everything is normal, there is nothing in the report, and still I am feeling pain in my stomach, or I have infection, or any other kind of physical symptom which is not coming in your lab reports. Why it's not coming in your lab reports? Because it's internally in your mind. Very common. Whenever we are nervous, whenever we go to for an interview, or we have to face an exam, many majority of the students, they complain that they have some kind of stomach issues. It can be a stomach ache, it can be loose motions, it can be vomiting, anything related to that. It's not just your physical health, it's also your mental health that is being affected. When we are unable to speak out something, we usually, that problem instills, बहुत दिन तक जब वो instill हो जाती है तो it comes up in the form of maybe some kind of throat infection. And then we say ki we were taking the right diet, we were taking the right things, I did not have ice cream, the day was fine, but still I'm having this problem. The problem is not the problem is not with your physical well-being, it's with your mental well-being, and you need to check it, because these thoughts, these emotions, they also govern your physical health. It's not just limited to your mental health or your cognitive abilities. So all the students present here, I would like to request you that every day take out some time before you go to bed, or maybe before when you start your day, just write out things, what you feel, what are you feeling good about, what are you feeling bad about, how are your emotions, just check it on yourself, because once they start piling up, it's very difficult to vent it out. So, if you do it daily, it would be very good for your emotional health. Studies prove that the top leaders, the top people in the companies have better emotional quotient rather than intelligence quotient. So, you need to work on your emotional quotient. So, try to introspect. Moving forward, how do I maintain a wealth? So, apart from introspecting within, what are the other things that you can do? You need to connect with people around you, acknowledge your feelings. As I said, always acknowledge your feeling, that why do I have a particular feeling for somebody and why it is. Even if somebody, if I have a certain not so good feeling for a particular person, maybe it's because of one of their actions. As a human being, maybe someday I can also be angry the same way that the person was with me one day. So we need to acknowledge those, that as human beings these are the common things, and because of one action or past, some of the past experiences, we cannot hold upon. We have to be very, we have to always be in a very good state of flow. If we keep on holding things, you cannot keep on holding things, and then you will get into problem, because you will just keep on piling it up. You cannot let it go. So practice letting go. If you acknowledge your feelings, practice letting go. Now, the importance of physical health. Uh, there's this interesting study that says that around 43.2% of they had find that people who have exercised 40 have less days of poor mental health than those who didn't exercise. Now, as we were just discussing in the last slides, that your mental health is also dependent on your physical health, and so it is vice versa. Your physical health is also dependent on your mental health. So when we practice more of breathing exercises, yoga, or even go for a walk for 40 to 45 minutes, it is very very fruitful when it comes to your mental health. It refreshes you and your mind to think in a better way, to take decisions in a proper manner. When you do more, if you are these days our lifestyle is much more packed and instilled in uh, table and chair. We are very much limited to a one room where there is no physical action. So here physical activities are very important. Apart from introspecting and doing other things, make sure that you have at least one physical activity that you're performing in the day. Maybe it can be a breathing exercise, you may be going for a walk in the evening or in the morning, as it suits you. So try practicing, try inculcating some kind of physical exercise in the form of game, dance, or whatever you like it, but you should do that. It's good for your mental health. developing coping skills. What is the first thing that we need to do when we suddenly feel not so good? If there is anything that has bothered me, maybe a simple thing from my friend, or any kind of ignorance or anything, the first thing that we can do is take a deep breath and relax. If you sometimes feel that you are overthinking too much, use your five senses. Try to uh, kind of divert your attention to your surroundings. Use your five senses. Like, see, decide one color that you like. Maybe it can be purple, it can be green, it can be white, anything. Now take that color and try to see five things of that same color around you. Similarly, take uh, uh, try to listen to some kind of music that you like. You know, seeing, practicing this visuals, or listening to some kind of music, embracing your senses, feeling your, even your breath, feeling it. Just the fact that you are breathing, if you just feel it, that also calms you down. Be in touch with your thoughts and feelings. This is the core of all the things that we have discussed. Moving forward to what, to this, mental health issues affect everyone. How many of you think that it affects everyone? Let's take a poll and see what are your views. So we'll be sharing a link in the message chat box. Please go through the link and please give your votes. Once you're done, please let us know. I think it must not take much time. Please do it fast, so that we can go ahead. Thank you, Yajit. Um, so, can we have the results on the screen? So now you can see mental health issues affect everyone. It can happen to anyone and at any point of time, despite of the color, gender, and the other things governing that. So this is how sensitive this topic is. When we say mental health issues can affect anyone, anyone at any phase of life or any time. So we need to understand the sensitivity of it. Today I am feeling better, but my friend might not be. My people around, those people around me may not feel that good. So we need to go to to the people around us, our family members, maybe the elderlies. घर में दादी दादा होते हैं, they are mostly ignored because the others are busy. It's not that we want to ignore them, पर क्योंकि सब लोग इतने busy होते हैं कि उनको time नहीं दे पाते हैं, तो we can go and ask them about it. Even our siblings, younger or older than us, everyone has some point of in life, that's something which is affecting them. So we need to go to them, talk to them about it, because today everyone has a lot of friends when it comes to social media, but not a single person with whom they can share what is going on internally. There are times where you may feel that I cannot share anything with anyone. That's the time where you can write down things. Whatever things are disturbing you, whatever things are there, just write it down and vent it out. That's one way of journaling, is one way of venting out all your emotions. If there is someone you see some kind of behavioral changes, be it your friend, be it your relative, be it your any of your family members, try to acknowledge it. Try to go to them with a kind of, not just to tell them that everything will be fine, but accepting that yes, the situation is difficult, but giving them hope that I know you can overcome it. It's, see, we many times somebody shares some problem with us and we say, yeah, yeah, we understand and you need to overcome that. No, we need to first acknowledge it. Yes, I know it's a hard time for you, but I am sure that you can overcome it. You can help in other ways and other advices if you have, but never start with that it's not a very big problem. Maybe that problem is not big for you, but that for that person. Everyone's mental health immunity varies from one person to one person. So we need to understand the sensitivity of it and see that why this is happening. Every time saying that everything will be fine, everything is fine, no, we can't do that. We need to check on that. So let's then what other things that we can do is, we need to check when we need to meet a psychologist. So there are certain symptoms through which you can observe if someone is going through it. You can suggest them to take a professional help. There maybe the appetite is too low or too high suddenly. In some individuals it's too high, in some individuals it's too low. So you need to check on that. Disturbed sleeping patterns, maybe they're not sleeping for the whole night and they're sleeping for the whole day. Maybe they're not sleeping at all. We need to check on that. Having low energy most of the time, or feeling unusually confused, edged, or scared. Like there are no particular rationale behind being scared or fear, but then that person is scared of. It can be, for students also, going and sitting in the classroom. After so long, they have been like almost in 2 years, each and every student was in studying in online mode. And suddenly getting into that classroom setting was not easy for all the students. So that fear can be even of attending the classes in a physical mode. So we need to check on that. Then if somebody says that seeing some kind of scary nightmares, or there are things that are disturbing them, or you may feel that person is doing some kind of self talk or believing something that is not there, you need to seek professional help. And then there are times when we are unable to perform the daily task. you know uh, it can be even for students can check on themselves, that many a times you study so well, you do all your work, you do all your assignments, but suddenly there is a phase of time where you don't feel like studying, you don't feel like doing your assignments. So just check on yourself, that it where from when you started feeling low. What was that? Was there any particular statement or comment from any of your people around you that you know has led to this? Just check on that. Write it down, whatever you feel it. It will help you. seeking professional help is a very good option when it comes to your mental health, because it's not only just limited to your mental health but your physical health too. So never hesitate taking professional help. Thank you. If you have any queries, any questions in your mind, you can ask us. Any questions?
Now you can turn on your mic if you have any questions, and you can ask her directly. If not, we will try to end this session. Anyone? Okay, I think nobody has any question, Aditi. And thank you
Yeah.
so much for joining with us and explaining beautifully this sensitive topic. And I believe that in future, if anybody has or sees anyone with such symptoms or any kind of issues related with mental health, or maybe it could be physical and mental, they should definitely seek help from professional, because they are trained into that kind of field and handling those symptoms and those things more carefully. And that's something one must practice in India. Basically, right now we do not treat mental health and all those things in a good way. We take it in a way that okay, ye ho sakta hai, ye pagal ho, something like that. Okay, I myself have felt
Hmm.
the same for many people, but that is not really good. In the after the post COVID era, like, we realized how important mental health could be, because we have seen many companies organizing events to take care of their employees' mental health. Living into the same room or same house for more than 6 or 7 months have actually impacted people and made them think or question exactly what their purpose is. Like, the cases of psychological help from professionals have increased after the COVID. And I'm really thankful to you for joining and talking with us on this crucial topic. And I appreciate your time and everyone's effort for joining and taking out some time to join this session. Thank you so much, everyone.
Okay. Thank you.
Thank you. Welcome. Everyone, you can leave now. I'll just disconnect the meeting. Thank you so much.